Hello, it's Edith Peterson. This is my IV push return demonstration video. First things first, Rebecca said if we have our peer signature to go ahead and show you, so I'm going to show that to you so I can put this away. I have it right there. Okay, I'm putting it away. Okay. And so first things first, you can see I am in the correct uniform. Okay, I've got my stethoscope, I've got my name tag, I've got my watch, and then I have my handy dandy pen and pen light. Okay, and so then for the purposes of this video, I will be sitting down just so that you can see what I'm doing. This is the best way to videotape it. Okay, so we'll go ahead and start. So I'm going to wash my hands. Okay, and I'm going to locate my MAR. So I have it right here. This is the one we were given. Okay, so it looks like we're seeing Mr. John Brown today. And he is in need of some ondansetron, 2 milligrams IV push, and he needs it now. Okay, so what I'm going to do is I'm going to use the drug book that I have. This is the guy that I have. And look up ondansetron. Okay, so here it is. So ondansetron, it also goes by Zofran. It's an antiemetic, so it's going to help with nausea. Okay, and then as far as IV administration, IV push, we're going to administer undiluted. And then the rate, we're going to administer over at least 30 seconds and preferably over 2 to 5 minutes. So as a nurse, I am going to choose to do over 2 minutes. Okay, I'm just going to set this aside so it's out of the way. Okay, all right, so I'm going to go ahead and locate my medication, which I have right here. Okay, so I have the ondansetron, and so this is 2 milligrams per ml. The order is calling for 2 milligrams, so I'm going to drop 1 milliliter of this medication. And it says it expires 02/2022, so we're good, it's not expired. Okay, so I'm going to go ahead and clean off my medication vial. If the dust cover was still on, I would pop it off and do the same cleaning procedure, but mine is already popped off. Okay, so we're going to cleanse vigorously for 15 seconds. And 15. Okay, and now we're going to allow that to dry completely. Okay, so while that's drying, I'm going to get my 3 ml syringe and my needle to prepare drawing up the medication. My packages are already opened just from practicing, but we're going to pretend like they're not. Okay, so open my syringe. Okay, and then my needle, and I'm going to maintain sterility while I connect these two. Okay, right. So I already said I'm drawing back 1 milliliter, so I'm going to go ahead and pull back 1 milliliter of air, which we got. That's good. Okay, and it looks like the top of my medication vial is completely dry. So we're ready. I'm going to loosen the cap. Okay, I'm going to drop that lid right off of there, and we're going to go drop the medication. We're going to go bullseye right in the middle, inject the air, and then pull up the med. So we got that. At this point, I would engage the safety, but for the purposes of saving my supplies, I've been recapping. Okay, so that's me engaging my safety. Okay. Then I have to get all the air bubbles out. Okay, we are looking good. Now I'm going to take the needle off and then put on one of my blue caps. Okay, so I take the needle off and put it in sharps. Then maintaining sterility, we're going to put on the blue cap. Okay. All right, now I'm going to fill out my medication label. So our patient is John Brown. The drug is ondansetron. The amount is 2 milligrams per 1 ml, added by me, put my initials there. The date is 4/6/20. The time is 11:30. There's no base solution because we didn't need to dilute it. And it expires, I think I said 2/22. Okay. So I'm going to go ahead and attach my label, making sure that I don't obstruct the markings on the syringe. Okay, so you can still see all the markings. Okay, so that's ready. I'm gonna go ahead and get my other supplies ready. So I have my 2 saline flushes. We're gonna get air bubbles out of them. We're going to put on our blue cap, maintaining sterility. Okay. Go there. I'm going to get the air out of this guy. Okay. I'm going to get my other blue cap. And I'm going to go ahead and maintain sterility while I attach these guys. Okay. And I got my alcohol swabs as well. Okay. And so at this point, I would tell the instructor, you know, I have ondansetron, and it's an antiemetic. It's used for nausea. We're giving it IV push, and it did not need to be diluted. And the rate of administration, it says at least 30 seconds, but preferred 2 minutes to 5 minutes. So me as a nurse, I'm going to give it over 5 minutes. Okay? Okay. And so now at this point, I'm ready to go into the patient's room. I have to move my camera a little bit and my chair over, so I will indicate that I'm entering the patient's room by knocking. Okay, knock, knock, knock. I'm gonna wash my hands. Hello, my name is Edith. I'm going to be your nurse today. right. Now, can you please tell me your first and last name and date of birth? Okay, I have John Brown, and 12/2/1960, 12/2/1960. Okay, John, thank you so much. And then everything matched. John, do you have any allergies? Okay, no known allergies. And then I don't see an allergy band. And make sure, yep, no allergy band. And I also didn't see any indication of allergies in the chart. Okay, so John, I'm here today to give you some medication. It's ondansetron, commonly known as Zofran, and it's going to be to help your nausea. Okay, and we're going to be giving it through your central line today. Okay, so then I'm going to perform my 5 rites, my medication, and my medication vial as well. And I have my order right here. Okay, so we have John Brown, 12/2/1960. We're giving ondansetron, 2 milligrams, which is in 1 ml. Okay, it's IV push, and we are giving it now, and it is not expired. Okay, I'm going to set that aside. All right, John. So I'm going to put on my gloves. Okay, so first thing we're going to do is I'm going to take a peek at that central line. Okay, let's look at your IV site. Do you have any pain or tenderness? No? Okay, awesome. I don't see any redness. I do not see any swelling. The dressing is clean, it's occlusive, and it's intact. Okay, so this is my central line for this demonstration. Okay, I did not have any red food coloring. So when I look for blood return, I'll just talk you through what I would expect with the normal central line, since I did not have the red food coloring. Okay, all right. So I'm going to go ahead and we assess the IV site. So I have my central line. I'm going to go ahead and choose this port is the one I'm going to give the medication through. Okay, so first things first is we are going to scrub the hub vigorously for 15 seconds. Okay, there's 15. Okay, now we are going to allow this to completely dry. Okay, we're going to say it's completely dried. Okay, and then I'm going to hook up my first flush, maintaining sterility. Okay, try to get in an angle so that you can see what I'm doing. Okay, so I'm going to unclamp. For the sake of this, I have to unclamp in 2 areas. Okay, all right. And so I'm going to pull back on my syringe, and what I'm going to expect to see is bright red blood in this tubing. And that's going to tell me that the central line is in the right place. Okay, so I pull back. Okay, I see bright red blood in the tubing, which is perfect. It's in the right place. Okay, I'm going to push the first 2 mLs slowly. I'm, seeing if there's any kind of resistance, which there's not. So then I'm going to do the pulsating motion for the rest of the flush. Okay, so first flush is done. All right, so you're going to grab another alcohol pad and get ready to hook up our medication. Okay, so we're going to scrub the hub again vigorously for 15 seconds. There's 15. Okay, we're going to allow this to dry completely. Okay, it's completely dry, and so now we're going to hook up our medication. Okay, so maintaining aseptic technique, we're going to go ahead and get that right on there. Okay, so here we go, we're ready to push our med. So I said we're doing the 1 milliliter over 2 minutes. So let's go ahead and get started now. Okay, and so as we're pushing the medication, I'm continually assessing the patient. Are you doing okay, John? You're feeling okay? Nothing feels funny? No? Okay, great. And we're also assessing the IV site as well. And everything looks normal, and I don't know any abnormalities, so that's good. Okay, and John's still doing great. All right, John, we're about halfway done, okay? That was 1 minute. Okay, continually assessing the patient, making sure he's doing okay, looking at that IV site, and everything is A+. You're my A+ patient. Okay, John, we're down to the last 15 seconds for the medication to go in. Okay, that was our 2 minutes. All right, awesome. Okay, so I'm gonna get another alcohol swab so I can scrub the hub again. Okay, scrubbing the hub vigorously for 15 seconds. Okay, there's 15. I'm going to allow that to dry completely. Okay, it's completely dry, so I'm gonna get ready to hook up my second flush. And so with this flush, I'm actually gonna go ahead and connect it, maintaining sterile technique. Okay, so with this flush, I'm going to flush the first 2 mLs in at the same rate that I administered the medication. So the first 2 mLs is gonna go in over 2 minutes. Okay, and then after that, I'm gonna use the pulsating technique to flush the rest. Okay, so we'll go ahead and start now. And John, you're doing okay? Feeling good, good. And that IV site looks good. Okay, we're halfway through the 2 minute mark, so that was 1 minute. done. You're doing great. Okay, John, last 15 seconds here. Okay, that was 2 minutes. So now I'm going to use the pulsing technique. Okay, all right. So I'm going to take this off. I'm going to clamp my central line. Okay, I have to clamp here too. Okay, now let's assess that IV site again. Are you having any pain or tenderness? No pain or tenderness. Awesome. I don't see any redness. I don't see any swelling. And the dressing is clean and it's intact and occlusive. Okay, John, you did fantastic. Okay, so I would clean up all my supplies. Okay, take my gloves off and wash my hands. Okay, thanks so much for watching.